Good morning, everyone. How you guys feeling? How hungover are you? I'm not at all. I'm delighted to be back at CES, and it's a real honor and pleasure to be speaking here, so thank you. The biggest technology show in the world. I've been walking around the past few days, checking out all of the cool innovations all around the show, and what I really love about CES is that it's truly a thermometer of what's happening in tech. And last year, if you guys recall, it was said that CES was all about IoT being real. IoT is finally here. I think this year we're evolving a little bit, and we're now starting to go beyond IoT into the Internet of Health things. That's what I want to talk a little bit today. So, baby tech. I am shocked to see how big baby tech suddenly has got over the past year. The amount of different devices that are tracking moms and pregnancy and babies on the skin, in the mouth, on the foot, on the bed, under the bed, it's pretty amazing. And we at Philips are also doing some stuff in this space, and it got me thinking. Do you guys think there's going to be a day where in the near future, we actually have babies producing more data than poop? Seriously. Yeah. And I mean, all this data that's being produced, all the alarms and the notifications and the recommendations, is that actually making us as parents calmer? Or is it stressing us out because there's just so much data that's coming in? Which fundamentally makes me ask the question, what do we do with all this data? There's like so many connected devices on the show floor here this year. Everything is connected. Everything is going to the cloud. Everything is trying to tell me how to live or do or act. So what's next in IoT? And at Philips, we're also collecting a ton of data. Over 7 million devices connected to be exact, and that number is changing every day. And what we've learned is that, what we've learned is that the data game is not really what it's all about. It's not just about collecting data. It's about how do you turn that data into something meaningful and actionable. And if you can figure that out, we think that's how you can start to change healthcare. And we think that is actually what the IoT is all about, at least for Philips. So timing is everything. And if you talk to anyone at CES who's been around startups, they'll tell you in technology, timing is everything. And I think for the Internet of Health things, we're at this perfect storm where societal demand and technology and costs and devices are all coming together. And something is just bound to happen. There's change in the air. If you take a look at some trends, the number of people 80 years and over is growing exponentially over the next 50, 60, 70 years. Today, we're just over about 125 million people who are 80 years up and over. By 2050, that's going to go up to over 400 million people. And by 2100, it's expected to increase to over 900 million people. Considering the cost that this particular population reflects in healthcare, that's not very sustainable. And it's not just elderly. The number of people with chronic conditions is also on the rise, and it's actually getting lower and lower in age because of lifestyle choices that we make. So the number of people with diabetes, with respiratory diseases, there's a staggering 1.5 billion people that are living with high blood pressure at risk for severe heart diseases. It's not sustainable. And on top of that, healthcare costs are blowing up, 70 to 80% of healthcare costs in Europe are spent on those chronic diseases. And in the US alone, 75% of our healthcare costs are going on chronic diseases. Something has to change. We're living longer, we're increasing the number of people with chronic diseases, our healthcare costs are going up, something has to change. Well, I think what needs to change is our healthcare system. We need to move from this reactive system that we live in today to a much more proactive system. What do I mean by that? Today, we wait until we get sick, and then we go to the hospital. We go see a doctor. And we have these like sporadic, disconnected experiences with our doctors, right? I tell my doctor what's wrong, my doctor helps me out, and then I don't see him for a long time until I'm sick again, and then I go back, and maybe I'll see another doctor, and they don't even talk. And we need to move to a much more proactive system where continuous monitoring can actually help prevent me from going to the hospital, for lowering costs. And so the key question is, how are we going to leverage all of these kick-ass connected devices that are all around, that we're showing all over Vegas this week? How are we going to leverage all this in order to really change healthcare? The thing is that most of these kick-ass devices that we're seeing here at CES are still islands. Right? You go down, you see a bunch of really interesting wearables and connected devices, medical devices, and they're collecting really, really interesting data in and of themselves, very meaningful, but all this data kind of sits in these silos, and there's very few of us who know how to act upon all of it. I mean, you know, I myself, I wear my wearables. I have a Apple smartwatch on this hand and a Philips Health watch on this hand, and they're collecting all kinds of cool information on me, right? My sleep patterns, my activity levels, my heart rate variability, all this interesting stuff. But you know what I really want? I want that information to be combined with the latest blood tests I took at the hospital with my doctor and my latest images to help me manage high blood pressure, to help me manage my cholesterol. I want a program for sleep that really takes into account not only the information that the wearable gives me, but what my humidifier tells me and what my weight scale tells me about the fluctuation of my weight over the past couple months and the nutrition that I have in order to really give me advice for having better sleep. That's what I want. We can't do that with these islands of data that exist today. The good news is that the technology is finally emerging where we are starting to be able to bring together data from all kinds of devices, from all different manufacturers, to really help build a bigger, more complete picture of our health. So what that means is now that data that you collected from the Bluetooth scale at home, and the data that you have from your wearable, and the data that you have from your connected light bulbs, and the data that you have from the CT scan that you took in the hospital last week, can now start to be combined for the first time to really uncover deeper insights about your health. And hopefully that will allow your doctors, your caregivers, to make better informed decisions in advance on what you need. But this isn't easy, right? This isn't easy. Like, how the hell are we going to actually make this happen? How do we bring all of this data together? All the data isn't the same, right? You have some devices that are a lot more accurate than other devices. How do you take into consideration things like data integrity? How do you cleanse the data? How do you normalize the data? How do you get rid of all the noise? How do you take into consideration privacy? Because some of this data comes from the medical world, and it needs to be HIPAA compliant. Some of this data doesn't. How do you ensure that patients have total control of access rights of the data? What I mean by that is, of all the devices that I say you can start to bring together my data, who can see what data, when, and how can they use that data? How do we ensure we allow that level of access rights? And even if you solve all of those things, it's still not enough. Because then that begs the question, so what? What are you going to do with that data? We need experts. We need doctors, physicians, behavioral change experts, psychologists, nutritionists to look at that data and then give me advice on what I should be doing. How can I change my behavior? What should I be doing different to change my health? Only then do we really start to change the game. So I'll give you some examples of what Philips is doing. For elderly care, at Philips, we have Lifeline, which I think many of you probably have heard of before. It's a personal emergency response system. And these wearables that our elderly Lifeline patients have been wearing for years, we now have over 40 years of data that come from that. Now, the data in itself isn't as interesting as what we've done on the analytics side. We've combined it with medical data from EMRs in the hospital system, and we've done some really, really interesting algorithms on top of that where we can now start to see things happen in real time. we're able to start to see changes in the way Lifeline customers are moving about, changes in how they sit in their chairs, changes in how they're standing up, their gait. And from this, we can start to detect deterioration. In fact, what we've done is we've leveraged all this data, and we can now predict up to 30 days in advance the likelihood of one of these customers having to go to the emergency room, having to have emergency transport to the hospital within the next 30 days. Then we can take that information and we can share it with hospitals, with doctors, to make the right decisions based on that information to take early action and prevent that emergency transport from having to happen. So this is what the IoT is all about, right? You take data, you combine it with other data, and we can actually take meaningful action. So now Lifeline customers not only are able to have longer independent lives at home, but we're actually helping them prevent going to the hospital. That's IoT. That gets me excited. Now, on the other side of the spectrum, let's talk about babies. So what are we doing with babies? Anyone who is a parent of a newborn or can think back when their babies were newborn, I can think back, it wasn't that long ago. It's pretty damn hard. It's pretty damn hard. And unfortunately, our babies don't really tell us what they want, right? They just cry. So we think that the evolution of the Internet of Things is going to actually start to give babies a voice, if you will, and really allow parents to better traverse this journey. So we do see a ton of amazing innovation that's happening in this space. We think that the future is going to be, how do we bring all of the data that we see from all the cool baby tech solutions out there and all the cool wearable tech solutions, how do we start to bring that together with analytics, with medical information to really help provide safer, more secure recommendations for parents? And did you know that the first 1,000 days of a child's life is the most critical for their long-term health? 85% of the child's brain is actually developed in those first 1,000 days. And so the nutritional information and the nutritional decisions that you make during pregnancy and those first 2 years are the ones that are the most critical for brain development, growth, and long-term health. So if we can help parents during those most critical days, not just tracking information with alerts that say when you flipped, when you got up, when you're crying, when you're not crying, but clinical recommendations so that they make the right nutritional information, so that they help them sleep better, so that they help them gain the right level of fat in their foods, et cetera. If we can help make those decisions, we can actually get better outcomes. We can actually help parents raise healthier children. The good news actually is that right now we already have all these millennials that are growing up with phones in their hands. And 84% of them are now having babies. And of course, a big percentage of those are turning to mobile for parenting advice. So given this, we've wanted to build a platform, a parenting platform, that really combines data from connected devices, from manual input, and from clinical information with analytics in order to account that every child is very different, every baby is unique, and to help parents make the right decisions during those most critical 1,000 days. And what does that look like? I have a little video here to share with you. So we're connecting this digital parenting platform with other Philips products like the Philips Avent baby monitor, and the entire Avent mother and child care product line is going to be connected up to this. And you might ask, okay, well, is this a platform that's just bringing together Philips baby devices? Absolutely not. So everything I talked about in this discussion is absolutely what we're trying to do. This has to be an open platform. We're here because we want to talk to lots of really interested partners who are doing super kick-ass stuff around connected baby, connected mother's health, pregnancy, and who share our belief that by combining this data and by having a more holistic view, you can actually add a lot more value for your customers. In fact, it's not just Internet of Things stuff. Many of you may actually have had your first baby picture taken by a Philips ultrasound. You know, our monitoring solutions are helping to deliver babies around the world for many, many years. And the future is really about integrating information from all of these worlds, from the hospital, from the home, from wearables, and bringing it together to empower parents and healthcare systems to make better informed decisions. How do we do this? All of this is built on top of an open infrastructure. UGrow is one of the first examples of one of the solutions that we built on top of the Philips Health Suite digital platform. So the Philips Health Suite digital platform is an open and secure cloud-based IT infrastructure that really has been designed from the ground up to allow devices to bring together health information from all over the world. It enables us to integrate information that comes from IoT devices, wearables, along with information that comes from hospitals and EMRs to really enable that unified view that I was talking about earlier. So no longer are we going to have these islands of siloed data, because frankly, that can't be the future of IoT. We have to go beyond where we are today. This isn't something that we can do in isolation. Collaboration is key. The Philips Health Suite digital platform has been designed HIPAA compliant from the ground up to be open. We want as many partners as possible who are building interesting things around health tech, who are working with hospital solutions, or wish they can tie their IoT solutions to hospital information to come join us and work on top of this platform. We're going to be opening up an SDK to encourage developers to take advantage of the ecosystem in the coming months. And we think that this is really going to be the future of healthcare. So this is where I think IoT is going. This is what the Internet of Health Things means. And for those here in the audience and those in the show that are showcasing their very interesting Internet of Health thing, baby tech or any type of connected tech, if you share this vision, if you agree that we have to go beyond our individual silos, let's talk. I think there's a lot we can do together. And I really thank you for the opportunity to be here today.